I want to say welcome to a few new people who have come to our organization. I think everybody, for the most part now, has met Dr. Jacobs. He's down here in center front. Welcome, Danny. This is his first official town hall presentation, and so any really difficult questions, he's going to be available to answer. I want to welcome Steve Campbell. Steve, are you here? There you are, right here. Steve's our new Vice President for Marketing and Communications. Thank you. Welcome. Comes to us from Cincinnati Children's. Mr. Tom Riley, our Vice President for Healthcare Transformation. Tom, right here. Welcome. And also the health systems recruited Ms. Deb McGrew, who will be joining us January 17th to serve as our new Chief Operating Officer for the health system. She's already been here. I believe they're looking for a home, getting situated. So we're excited to have Deb join us from UAB and looking forward to her official start. A few things on the agenda, updates, recognitions. Again, talk a little bit about where we're going, and then we'll take an opportunity to address a few questions. Some highlights. Congratulations to all of us for another great year relative to our state employee charitable campaign effort. Mr. Elger, this year's chair bill, we're close to $500,000. Is that correct? Well over our goal, so thank you so much. Thanks to Becky Trout. Thank you to all of you. This is a very, very, very important effort. Now, I know a lot of us give charitable contributions directly to a lot of organizations, but the SECC is part of the state of Texas' overall United Way effort. And what we do here in the Galveston region is a big part of what the Galveston region does as a whole. This is important symbolically in terms of what UTMB gives back to the communities that we live in, to the communities that we serve. So thank you very much for helping us create another great effort with the State Employee Charitable Campaign, and please give yourselves a big hand. Congratulations to our colleagues in the health system and all of our colleagues who worked with our health system colleagues to achieve a great result with the Joint Commission survey. The surveyors were here the week of November 26, showed up bright and early right after the Thanksgiving holiday, and were hard at it in terms of visiting a number of our facilities, assessing our compliance with the almost 250 standards, the 1,200 plus performance measures that are involved in a survey, and at least from my perspective, we came through it with flying colors. The surveyors were very complimentary of our people, of their approach to care, their familiarity with the standards, with excellence, what practice consistent with excellence looks like. We did get some recommendations for improvement. That's pretty typical. Our number actually was quite low. So we were very pleased with the result. And again, congratulations to all for what I think was an outstanding survey effort. Victory Lakes expansion, some of you were following along when the regents gave us their approval for moving forward with our plans for the next step in terms of construction, new facilities on the Victory Lakes campus. I mentioned, I think, in the last town hall and perhaps the one before, that we have one big remaining facilities gap in terms of offering a broad range of healthcare services to our patients. And that is, we don't have a short stay inpatient facility on the mainland, and we don't have a good way to extend the delivery of emergency and urgent care services to our patients who live and work on the mainland. They typically want those sorts of services within a few minutes' drive of their homes or places of work. Well, this facility addresses that gap. It provides for the addition of close to 40 new inpatient beds, which will be designed for short stays, 72 hours or less, for patients undergoing surgical procedures or requiring short-term stay for medical problems. It also provides for 17, 18 or so emergency urgent care beds, some new operating rooms, some new procedural areas, some delivery areas for relatively uncomplicated deliveries. So again, rounding out the range of services available to our patients who live on the mainland. It's about an $82 million investment, 140,000 square foot facility. Goes on now to the coordinating board for their review. We're moving along in terms of ramping up our planning to get started with construction of that facility, pending final approvals. And when we get it all going, we'll start construction and be ready for occupancy in about 2015. So thanks to all who have been involved in that planning effort, Mr. Schreiner, Ms. Sollenberger, all the members of the facilities and healthcare teams to help us work to address that final gap in our facilities that support healthcare delivery. A lot of great things happening with our faculty as always. I can never list all of the forms of recognition and reward coming to our faculty members for their marvelous efforts, but I did want to list a few. You know, there's concern about what's happening with research funding, about support from the National Institutes of Health, and our faculty continue to fare well, even in the face of increased competition and reduced funding. Dr. Brazier, Dr. Garofalo were actually, I think, featured in an article in today's Galveston County Daily News in terms of recognizing this grant award to support the study of airway inflammation, particularly in the role of the development and persistence of asthma. So congratulations to these two and the team that's been working with them for this marvelous award and continuing this effort to try to get at the root of the asthma problem. Dr. Ottenbacher and colleagues have been awarded another grant to move along our study, our efforts to address rehabilitation science. This particular one is focused on helping us train additional specialists who can both deliver rehabilitation services and who can help us study rehabilitation services in science, hopefully to improve our methods over the course of time. So congratulations to Ken and colleagues for that particular grant. Dr. Loree Thomas has been awarded a HRSA grant to help provide student scholarships to help us continue to reach out to students who typically have had poor access in terms of entry into medical school. It's a $2.6 million grant over 4 years, and so that will allow us to award about 40 to 45 scholarships for about $15,000 each to students over each of the 4 years. And of course, that's great. It helps the students offset their tuition and fees cost as well as housing cost, and allows us to take some of the current scholarship monies that we're using to support that need and move them to support other students also. So some marvelous results related to this particular grant. Congratulations to Dr. Thomas for that particular grant, a marvelous effort to increase training opportunities, access to medical school. 32 of our faculty members have again been recognized by Texas Monthly as super doctors. We're very proud of them. Of course, I think all of our doctors and nurses are super, but this is a very special recognition. Congratulations to those so recognized. Dr. Karen Wagner has been named a winner of the Colvin Prize for Outstanding Achievement in Mood Disorders Research. Dr. Hirschfeld tells me this is at the top of the heap relative to recognition for psychiatrists. Also, this is the first time that this award has ever been awarded to someone who studies child and adolescent mood disorders. So I think that's certainly significant, but of course it's consistent with the marvelous work of Dr. Wagner over the course of time. So congratulations to her. If you see her, please offer your congratulations on this outstanding achievement. I also want to, maybe I should just call out Alice Ann O'Donnell. She's retiring officially during this month or at the end of this month. She says she has some other things that she wants to do. Many of you know Dr. O'Donnell quite well. A long and storied career at UTMB. She's well known around our state and around the country for a number of different efforts. She's a distinguished professor, was a founding member of our Department of Family Medicine, Oslerian Scholar, received the McGovern Award for Lifetime Achievement in Oslerian Medicine or related to the practice of Oslerian medicine principles. So if you see Dr. O'Donnell, tell her congratulations and thank you and wish her well as she pursues new opportunities in the months ahead. A lot of times I get asked as I move around and talk to different groups, you know, what sorts of success are we achieving beyond those faculty recognitions and grants and the like? Are we getting any gold medals or recognition? So I thought I'd offer some thoughts about some of those just to show that we are being successful across a variety of efforts that occur every day at UTMB. Our transplant center was recognized recently with a silver medal award for work in lung transplantation. You say, well, what does that mean? Well, this award is given to transplant groups who make significant progress in terms of reducing mortality among patients waiting for transplant, achieving outstanding results immediately after transplant and over the course of time, better survival, reduced mortality for transplant recipients. 44 transplant groups were recognized around the country. Only 6 lung transplant programs were recognized, adult lung transplant programs. Ours was one of 6. That's pretty incredible. And so that clearly puts us in the top, at the top of the heap relative to lung transplant programs. So congratulations to the Texas Transplant Center for this outstanding effort. Our Human Pathology Translational Medicine graduate program recently won one of 5 AAMC Innovation Awards. This particular program is designed to pull graduate students together with medical students with the idea that we will improve translational research over the course of time by bringing our PhD students and medical students together to think about the combination of scientific issues and practice of medicine issues, where we stand today and how we work together to improve our approach to diagnosis, treatment, and prevention over the course of time. So congratulations to the leaders of that program, to the participants. That's outstanding news and very appropriate recognition. I want to throw kudos out to Chief Ingalls and members of our police department. They recently achieved a CALIA certification. This is the certification that comes to police agencies relative to performance against a set of excellent standards. I think only about 3%, Chief, among all the police agencies in the country achieve this level of certification, and we're one of only 30 agencies within the state of Texas that's fully certified or accredited by CALIA. So congratulations, that's outstanding achievement. I want to invite Dr. Marshall to come up. He wants to make a special presentation relative to the magnet recognition. David?
Good afternoon, everyone. As you probably remember, in August, we learned that our journey to achieve magnet recognition for excellence in nursing came to fruition, and we were awarded magnet recognition. And they finally sent us the obelisk, which signifies our magnet recognition. And I wanted to present this obelisk to Ms. Sullenberger and Dr. Callender and the entire UTMB health community on behalf of the more than 1,250 nurses who work in the UTMB health system. So, without further ado,
you deserve it.
The magnet obelisk.
That's beautiful.
Thank you both for your support, without which we could not have achieved this recognition.
Well, thanks to both of you and all of our nurses for really hard work and for outstanding performance over the course of time. I don't think from my perspective, David, that we've ever stepped away from adherence to the magnet principles. Our nurses are just outstanding. They're compassionate, they're caring, they're knowledgeable, they're skilled. It took a while to put ourselves back in the situation where we could apply again, but congratulations for helping us uphold those principles and demonstrate publicly that we are at that magnet level of performance. So congratulations to you, and thank you very much. Thank you. So we're getting bronze, silver, and gold medals all the time. But the challenge is that, you know, we never get to the point where we get a gold medal and then we can just hang them up. Then what's the next medal? What's the next level of achievement that we are pursuing so that our people can be recognized, so we can continue the impact in the communities we serve and really around the world? So that's the challenge. I know we all feel that. And, I've talked before about, gosh, what's happening around us? Why do sometimes we feel there's so much to do? And it's hard to perceive a sense of progress. Well, number one, there still is a lot of uncertainty in the country. What did the election resolve? I'm not sure. We certainly had one, and we have results. But we sort of have the same political division that existed before. We didn't move that forward. We've got all this economic uncertainty. So, and of course, all these things will work themselves out over time, but we're not making any rapid leaps forward. So for all of us, we continue with our daily activities. We continue to recognize that there's this uncertainty around us. At the same time, we understand that there's a lot that we want to do and that we need to do to continue to achieve those bronze, silver, and gold medals. And I appreciate what everybody is doing to help us do the things we're supposed to do and make the case for UTMB that we are doing what we're supposed to do for the state of Texas. So I don't think the uncertainty is going to continue. The Affordable Care Act, I mentioned on this slide, yeah, it's going to be implemented. It's now at least not politically going to be pulled back, but there's still a lot of issues, a lot of uncertainty. So we'll monitor its implementation, make sure we're in the right place relative to what happens. We've got the new legislative session that's starting in Austin, a new Congress that's coming in beginning January 3rd. We'll be there telling the UTMB story, and I think we have a good story to tell. We've had, thanks to Dr. Raymer and Mr. Matthews and our legislative staff members, we've had a number of legislators both from the state and the federal level visit our campus over the last few months. And to a person, they've been very complimentary, very impressed with what's happening here, with what our people are doing, with what we're achieving. And all of them have made it a personal point to encourage us to continue what we're doing and to actually step out and tell our story, tell people about how we're creating success, how we've done it, and how we're going forward. And I think we have a great story to tell. As I've said before, we're incredibly creative. We're very collaborative. We work well together. We're planning all the time. We don't just create a set of plans and put them on the shelf. We use them. We talk about our priorities. We change them over the course of time relative to what's happening around us, to our understanding of what we're supposed to do. And our people work really, really, really hard, and that hard work is recognized with the sorts of awards and achievement recognition that I mentioned earlier in the presentation. So we are doing good work. We're making progress. We had a great year last year. The fiscal year ended August 31st. We were financially successful again. We worked really hard to manage our resources well. We've grown our student enrollments quite markedly. Those of you who aren't directly engaged in the academic enterprise don't probably remember that our enrollments at the time of Ike were about 2,600 in the aggregate. You know what they are now? Close to 3,100. So in spite of all the facilities and resource challenges and cutback in funding, we've been able to grow our enrollments. And our student outcomes continue to improve over the course of time. In the face of a lot of challenges relative to support for research funding from state and federal sources and granting agencies, we've had pretty stable expenditures, and our faculty have worked hard to be even more competitive for the awards that are available. In the last year, our NIH funding actually went up some compared to a lot of other places like us where it went down some or more than some. So again, our faculty are working hard. We're accomplishing a lot relative to research. We continue to grow the number of patients that we're serving. I think we had almost 700,000 visits last year, 680 some odd thousand, 26,500 admissions last year. 162,500 discrete patients, something like that. So that's incredible. I mean, we continue to grow the numbers, grow the service, in spite of the fact that there are challenges all around us all the time. And we continue to make investments for the future. We're investing in our infrastructure, business, information technology, human resources to prepare for the changes that we know that are coming. And when we can't predict what those changes will yield, then we know that we need to make ourselves maximally flexible to accommodate those changes that we know are coming. So we're in the process of doing that. We continue to improve our facilities. Look around. I talked about what's happening at Victory Lakes. Look at the hospital, the clinical services wing coming out of the ground. Just think about what's happened in terms of recent openings. Student Testing Center, the PCP. We've got the ground floor of Old Red that will soon become available as a beautiful new student study space. We've got the concourse through the hospital. We have the School of Nursing and Health Professions open again with marvelous concourse. A lot of things happening to make our facilities not only recovered from what happened with Ike, but even better for the future. So great things are happening. We're doing well in spite of the fact that there's uncertainty and challenges out there. I think we have a good framework for success. We have this living, dynamic, strategic plan. And by the way, we've got copies of the latest version of the institutional plan when you leave today. If you haven't seen it, please pick one up because it lays out our priorities, what we've worked together to decide that we want to do over the course of the next 3 or so years, the Road Ahead document. But it's based on just solid fundamentals about attracting and retaining the best people, about providing the highest levels, the highest quality service, not only in terms of the healthcare services, but all the other services that we provide to each other and to others. Continuing to play a role as leaders in health sciences education, moving forward our efforts to further our curriculum, efforts to improve our student outcomes. We've been successful on those fronts, and I think we will continue to be as we go forward. Continuing to work to advance the impact of our research, its impact on diagnosis, prevention, treatment, whether it's basic research, translational research, clinical research, it's towards those goals. We're sharpening our research focus now. We have to do that, but making progress towards improving that impact. We want to be the model for an academic health sciences center or a health system associated with an academic health sciences center. We want to continue to manage well and manage strategically. Going back to what I said earlier, be flexible, be able to change our plans, adjust them based on what's happening around us, and then be successful in managing our resources to achieve the outcomes we want to achieve. And finally, we certainly want to continue to serve the communities that we serve very well, with a sense of commitment, engendering collaboration from the members of those communities to help us be successful as we go forward. These are the foundational elements of our plan and help us check that we have our priorities right as we move forward with the plan for any successive 3-year period. As we look at the remainder of this fiscal year into the next calendar year, we are working to continue to grow the range of clinical services and the overall clinical services effort. That's important to us on the educational front, on the research front, on the healthcare services front. As I mentioned, sharpening our research focus in this competitive environment, it makes great sense to do that so we can continue to attract the research funding that we need. Improving the student services and support for student efforts here, reorganizing our student health efforts, improving the study spaces, improving the IT infrastructure that supports student efforts, improving scholarship support for our students. All of those efforts are moving along. Enhancing our service and quality, again, not only in the health system, but in the areas of business and finance and support and all the other areas that constitute UTMB. I talk about the investments that we're making in the business and IT infrastructure. UTMB Connect is the very visible, palpable effort on that front, which will help us consolidate our support for the patient services or the sort of back office support for the patient services that we deliver and provide those more efficiently and effectively. And continue to improve the systems that support our people, particularly compensation systems. I've talked before about for faculty, for staff, everybody who works at UTMB, we want to have compensation systems that are understandable, that help us all understand what we're supposed to make, where it stands relative to the market, why we get paid what we get paid to do our jobs at UTMB, and I think we're making progress on that front too. So as we think about what's before us, about continuing to create success, there's some things that I'd like to ask you guys to continue to help us to do. Number one, I think it's always great to make sure we understand what we're supposed to do, what our individual effort needs to be, what our individual priorities are in terms of helping our institution achieve success. And then as we move forward, clearly most of the time, it's not just what we do individually, it's how we work with our colleagues to create that success that's so important. So work with others to help them understand what they need to do, help them speak to us more easily about what they need for us to do in support of their success. Very critical that that happens also. Work together to monitor our progress towards the goals that we've identified in the Road Ahead document and the missionary strategic plans, the support area strategic plans. Check off our progress as we go forward. Continue to hold ourselves to the highest standards in terms of the outcomes that we want to achieve, the processes that we use to achieve those outcomes. Everybody comes to work wanting to be the best they can be. Let's make sure that we hold ourselves accountable for making sure that happens at UTMB. And as I've spoken to you about in the past, continue to forward this concept of culture of trust that embodies this accountability and high standards for behavior and approach to work. If we have that, it's going to be hard for us to not be successful as we go forward. So that's the message that I wanted to deliver today. Again, thank you so much for being here. Thank you for the marvelous effort that's helped us achieve those bronze, silver, and gold medals in the past, and I look forward to us achieving many more as we move forward into the next year and the years beyond. Questions? I think Raymond has some questions that have been submitted.
I have Dr. Callender. When will inpatient psychiatric care return to the UTMB campus? And is there any opportunity to increase UTMB bed capacity without sacrificing all these efficiencies and progress that we've witnessed during the tenure of our current leadership team?
Okay. Donna, do you want to address that?
So this is obviously a need that we recognize, and we need to be able to address it both locally and also for the region that we are now anchoring. It's a 16-county region that we're anchoring through the Medicaid 1115 waiver, which CMS gave to the state of Texas to help transform how care is delivered to Medicaid patients. So really two observations. One, are we going to ever reestablish psychiatric beds on this campus? And the answer to that is that we are definitely going to do a plan around how to reestablish that, but it's going to require us to move out of the John Seeley Hospital or Adult Med Surg and move them to the new Jenny, because right now we don't have spaces to do that. But I have committed to Dr. Hirschfeld, the chair of psychiatry, and to others who have this same concern that we will start looking at what it will take to create that unit in the next fiscal year through a business planning effort. We want to do that to make sure we don't lose some of those efficiencies that we have gained over the past several years. One of the real opportunities that I feel we have is through the 1115 waiver. When we work with our 16-county partners, what we find is the biggest single health need across that's common to all of those counties, including Galveston, is access to mental health services. So part of the waiver is to have delivery system reform projects that each of the counties propose, And when we look at the ones that have been proposed in our region, there are many creative models that will, I think, be very transformative for assuring more access to the primary level of service so that many of these conditions can be kept in check and managed well, but doing that more in the outpatient setting so that our beds in our region are reserved for those with really serious psychiatric needs. So the answer is yes, we're going to look at the inpatient, reopening inpatient facilities, but do it in a thoughtful way. And B, we also believe that through our leadership in the waiver, we can transform access to and delivery of mental health services to patients.
Great. Thank you very much. You know, I forgot, we have some newly elected members of the Employee Advisory Council. Do you guys want to introduce them?
I'm not in emergency services anymore. I was there for 9 years. I'm out and outpatient now. I'm in the clinics. I'm a practice manager at League City Pediatric and Adult Primary Care. So happy to be part of the council. Thanks.
All right, very good. Thank you.
And I'm Neil Cooper in the Office of Sustainability.
Thank you, Neil.
And Amina Barada was also reelected in the academic enterprise.
Okay, we had one more, didn't we?
Yeah, CMC.
Who is it? I'm sorry. Oh, Danae Robeson from CMC. She's our fourth.
Okay, great. Yeah, Danae's from CMC. Okay, very much. Or thank you very much. Do you guys have some questions too that came in through the EAC?
Yes, sir. The first one is several questions came in regarding pay raises for CMC employees. The following is a summary of what we received.
Okay.
I'm a correctional care employee, and speaking for most of my coworkers, we are going on 5 years without raises in CMC while the cost of living is rising. Non-CMC UTMB nurses have been discussing their merit raises and market adjustments, and we are all eager to find out if there is more money in sight for CMC employees.
Thank you very much. I'm going to ask Dr. Murray to address this. Let me just say that as we, UTMB, and our colleagues from Texas Tech have testified to our legislators in these interim hearings about correctional managed care and the Texas Department of Criminal Justice needs. Our first priority has been to get funds appropriated to support compensation increases for our staff. They are outstanding, said that many times, long-serving, extraordinarily dedicated, very appropriate from our perspective that they be recognized for their efforts. We keep them in the right place relative to the market. Unfortunately, that's not a decision we can make on our own. So we all have to lock arms as we go into this legislative session and make the case for that to happen. With that said, Dr. Murray's engaged in day-to-day management of that enterprise, so we want to get his perspective too.
Well, I don't think I could say it much better than that, but the bottom line is the question is being asked by 3,000 other CMC employees. They have not had raises in 4 years, and certainly we've had 2 reductions in force. We've changed their working environment significantly, changed hours of operation, and really asked them to do a lot more. So from that perspective, what we put in our legislative appropriation request was a 5.5% increase for FY14, and then a 2% increase on top of that in FY15. Obviously, as Dr. Callender points out, that's not our decision to make. But I think that, you know, in talking with TDCJ and their leadership group, I think they're very supportive of our position on this. You know, I think when it comes to, and obviously the legislature is always looking at the constitutionality issue of prison health care, and that from that perspective, you know, it really does start at the facilities. You've got to have staff to be able to deliver health care and deliver services in a timely fashion. So from that perspective, as I said, I think TDCJ is certainly in line with what we've requested and asked for. Hopefully we'll have their support, and hopefully we'll be able to, after the session, go back to our employees with some, I think, positive news about salary increases.
Great. Thanks, Dr. Murray. You know, one of the biggest challenges that we have, at least in terms of communication, is reaching out to our marvelous colleagues who serve around the state, particularly those who serve in the units. We all know they do a marvelous job. They are a part of UTMB, although sometimes it doesn't seem that way because what they do is a little separate relative to the way the state manages that part of our enterprise. But would you all please join me in helping me express appreciation for what they do and for the marvelous professional approach that they use to provide care to a very needy group of patients. We want to say thank you to all of our CMC colleagues. Thank you very much for what you do. Raymond, you have another one?
Yes, sir. This
Okay.
one concerns compensation as well. The midpoint of my salary range has increased, and after my current raise, I make a smaller percentage of the midpoint than when I was originally hired. Can I expect any type of market adjustment to my salary in the future?
Dr. McKinley, you want to talk a little bit about what's happening with merit and market increases across the institution?
Sure. The adjustments would be made because a particular salary range or now we have bands, advances is tied to the minimum of that range, not the midpoint. So there are no automatic market adjustments because the midpoint moves in someone's comp ratio, their penetration of the range is less relative to that. Should a person's salary fall below the minimum, then we would look at that, and that salary would be moved to at least the minimum as long as the person was performing against the performance expectations of that job and their particular position. So that's, so the answer is no.
Okay.
Okay.
All right, so it's really a change in the way that we think about the market and the way that we peg the benchmark or create a benchmark for where we stand in the market. So there's a little bit of education now involved still in explaining the way that we're using market information. And then, if I understand correctly, there's then a much more significant look at performance and years of service in terms of deciding where somebody falls in a range.
That's correct.
Okay. All right, very good. So, and that's modern compensation, at least as we understand it today.
That's right.
The way most big organizations do it.
That's correct.
Okay. Thanks, Dr. McKinley. Another question from the AC?
Yes, sir. I am a nurse with the UTMB CMC and would like to know why we do not get compensated for weekend holidays worked. And when we do get holiday pay, it's for 8 hours when we actually work 12-hour shifts. I chose to work this schedule, but when Christmas and other holidays fall on the weekend, as Christmas did last year, I should be compensated for it as well as the other nurses and faculty that work weekend schedules.
Okay. Dr. Murray, I need help with that one. I'm not sure how those systems work in detail, so if you don't mind.
All right.
You can call on Dr. McKinley, too, if you need his help.
Well, this question has come up repeatedly as we've gone back and forth from 8-hour days to 12-hour days, depending on hours of operation. But we really just follow the state guidelines, and that is reimbursing people for 8 hours of holiday time. At times, I guess it doesn't seem fair to those who are working the 12-hour shifts, but that really is the guidelines, not just for UTMB, but for every other state agency. So we're following that policy. Is that correct, Ron?
Yeah, that's correct. In fact, it's in the Texas government code. It's the law. So if a holiday that's a normally recognized holiday by the state falls on a Saturday or Sunday, it's not compensated. It's not a holiday. It has to fall on Monday through Friday and then be on the list of approved holidays for state employees. So.
Quirk in the law. Okay, well, thank you. I learned something from that one. Thank you, Dr. Murray, Dr. McKinley. Raymond, do you have some more?
Yes, sir. Another one from CMC. Should employees be paid according to the work they actually perform? I work in CMC on a large unit with exceptional LVNs and certified medical aides. Their pay range is the same as other LVNs and CMAs that work at much smaller units. Those of us who work at larger units have a greater patient load and patient population number and should be compensated accordingly and appropriately.
Well, that's a really interesting question, and one that, quite frankly, the simple answer is that we have facilities of all sizes. We have facilities as large as 4,200 all the way down to facilities of less than 500. But we staff basically around, on a percentage basis, of the number of offenders to the number of healthcare staff. So larger facilities have more staff, smaller facilities have less staff. Again, we have talked about, and I think whoever's writing that question probably comes from one of our maximum security facilities. That has been a topic of discussion. Should we pay more to people who work in maximum security environments? There's potentially more risk, et cetera, a little more difficult to staff some of those facilities, larger segregation populations. But ultimately, if you really look at the breakdown of business and how much how many interactions we have, and we've got great data on that, it all kind of evens out. And so it really is the most fair way to do it based on the number of offenders at the facility and the volume of work they create.
Okay, thank you, Dr. Murray. I want to address one question that I continue to hear as I meet with groups around the institution while the EAC folks give us another one. Several people have asked me, in light of all the announcements about new medical schools in Texas, University of Texas Board of Regents talking about support for a new school in Austin as well as one in the Valley, the latter announced this past week at the urging of Chancellor Figueroa. I think our state needs more medical school graduates. I think it's marvelous that two of the most significantly underserved areas relative to academic health sciences efforts, the greater Austin area and certainly the Rio Grande Valley, now have the opportunity to have a medical school and academic health sciences center. The Valley has that to some extent with the RAC, the Regional Academic Health Center, but what's planned now is to extend that effort over the course of time and actually make the combination of University of Texas academic institutions, new medical school in Iraq, the Regional Academic Health Center, the higher education focus for the UT system in the Valley. That's great. Does it mean some more competition for us? Absolutely, sure. But you know, in the greater context, that's okay. I mean, those efforts will be funded by a formula that brings dollars based on their academic activities, so that's an addition. When we consider the fact, something I mentioned to you guys several times, that Texas ranks 42nd among the states in terms of the ratio of physicians to population, put that up against the fact we're the fastest growing state in the nation. We need more doctors. We need more medical school graduates. We certainly need more residency positions. So in all, I think this is a great thing for our state. And we talked about gold, silver, bronze medals. We're doing okay. So bring it on. We'll stand up to the competition. We'll be okay. So I appreciate the question, and I think it's all good. Other questions?
An email was sent out several weeks ago describing a review process of the ASG groups and others in the School of Medicine. Has the review been completed? If so, are there plans for making changes? Please communicate the outcome of this review as soon as possible. There are many rumors circulating.
Yeah, whenever there's a lack of information, people start to make it up. So we recognize that. But it's very important that Dr. Jacobs and I, Ms. Hallenberger, Mr. Elger, everybody involved in thinking about the structure of the academic enterprise and medical school have some time to process the feedback. What started this was a lot of feedback, not just recently, but over the course of time, that the administrative services group structure that we created after Hurricane Ike, at that very difficult time when we had to consolidate a lot of resources, is outmoded and outdated. And in general, the feedback that we've received, and the feedback process is pretty much completed now, has really cemented that impression that we need to move forward and do this a little bit differently to provide the appropriate levels of support for the range of faculty activities that we have today. That's not an immediate decision. Dr. Jacobs still relatively new, although he's moving along quite nicely in terms of his understanding of how this place works, but more to come. Our ASG leaders have been very patient. They're doing a great job continuing to work with the chairs and the faculty, but it's pretty clear we need to do this a little differently and augment that set of services available to faculty. So we're going to ask for a little bit of patience on that front, a little bit longer. I think after the beginning of the calendar year, we'll have had the opportunity to process this feedback a little further and come back with some ideas, some steps to move forward, and some additional steps to consider to try to better align what we want to do with ASG support services with faculty needs. So I'm sorry it's taken so long, but we do want to get it right. Well, thank you for that question. Raymond, another one?
Yes, sir. Will any of the new healthcare laws due to go into effect in the year 2014 affect the health insurance of UTMB employees, and if so, how?
Dr. McKinley, you're running a close second to Dr. Murray in terms of demand for your time here.
Actually, I think our health plan has taken into account all the key changes in the Affordable Care Act, and in fact, we've even done a lot of them earlier than the law requires. So it should not. I suspect the question really is, will it have a negative impact on our health insurance? And it doesn't appear that it will.
Okay. So. Yeah, some people have asked me, is it going to be considered a Cadillac plan and be subject to taxation? And so I know that there is some concern about that.
There's concern about that. That's true. So now that may a possibility. Then that is a possibility, but we don't know that for sure.
Yeah. Okay.
But the level of coverage and things like that should not be affected.
And it seems like, from what I've heard, that the UT system is prepared to make adjustments.
They are.
Based on final rules and the like, to keep us all in the right place, to keep the system in the right place.
That's correct.
As a state agency, we certainly want to be in the right place. So more to come on that front, but right now we think in general we're in compliance with the law and we're in a good place, and we'll make adjustments as need be.
That's correct.
Okay. All right. Great. Thanks, Dr. McKinley. One more from the EAC. Suzanne?
First, I'm going to say, don't kill the messenger, okay? We just get the questions. This one says, are some CMC administrators receiving a $10,000 bonus this year?
The long answer to that is no.
All right, so that's another one of those rumors that's out there. Pretty easy for Dr. Murray to say, no, that's not true. All right, very good. Well, thank you all. I'll be happy to hang around and answer additional individual questions that you have. Also, if you submit them, we'll post the written responses to questions out on the website probably within the week. We have a few that have been submitted that are still being processed, so we'll try to get the answers to those out there. I do want to again say happy holidays. You all know this is a special time for members of our UTMB family. It's a marvelous time of the year to celebrate the diversity of our UTMB family. We actually make it a point to allow our people to display the symbols of the celebrations that occur at this time of the year. Very important that we remain a diverse organization, that we use that diversity of thought and background to craft the most creative solutions to the problems that affect us, affect our patients, affect our nation. And this is a wonderful time of the year to recognize that diversity. Now, not everything's celebrated this time of the year, but many things are. Christmas, Hanukkah, Kwanzaa, Yule, the winter solstice, many different celebrations involving the triumph of light over dark, the winter solstice, the beginning of the longer days towards the summer solstice, the evergreen trees and the concept of evergreen and mankind's ability to look forward and move forward as opposed to look back and fail. All the sense of renewal and triumph that comes with Christmas and Hanukkah. So many great things to celebrate, and even if you don't have something to celebrate, use this time to celebrate with others and celebrate being a part of this wonderful institution and this wonderful family. So my family happens to celebrate Christmas, and so I've got on my Santa Claus tie today, if you see that. So please display your symbols proudly. It's okay to talk about those. We don't support one over the other. Have a marvelous holiday season. Thank you so much for your contributions to our wonderful UTMB family. Let's all continue to work together to achieve even greater success as we move forward. We've got some holiday cookies and some hot chocolate for you in the foyer, so please enjoy those. Take some back to your colleagues if your pockets allow, and have a wonderful afternoon. Thank you very much.